right, well, thank you very much. I'm actually really excited. This is our very, very first, would you call it the toolkit, the first tool in your toolkit from Harmony Hill. My name's Dr. Bonnie McGregor. I'm the clinical research director at Harmony Hill. That is a new position for me that I'm very excited about. And I'm also the founder and the program director of the Orion Center for Integrative Medicine. Before I was at founded Orion, I was a behavioral scientist at the Fred Hutchinson Cancer Research Center for about 20 years. And during that time, I did a lot of research looking at the effects of stress, psychological stress on immune function, and also then how we could intervene, like treat psychological distress in cancer survivors, and then look to see for changes in immune function and other health outcomes. And I'm going to talk a little bit about some of the work that's been done in this area, and also some really exciting stuff that we've got going on now. And also, as promised, stress management tips and techniques for all of you to use right now, because we need them. So, as everybody knows, it's winter time. It's such a beautiful time of peace, and the darkness happens. We just look for the light. We turn ourselves inside with great reflection and gratitude. It's just a beautiful, peaceful time of the year, right? Not really. This is an old picture, but I just love this feeling that you get of the weather, the force of the weather in this picture. And there's always shopping. This is like pre-COVID, but this just gives you a sense for what it feels like this time of year for everybody. Traveling, shopping, it can be a lot. And you add that on top of being a cancer survivor, which just gives you this sort of steady dose of low-level stress, which bumps up at times. It can be a lot. So here's your first stress management technique. One is to change your focus. So we're looking at all those stressful pictures. Now you can look at something beautiful, and you can notice in your body how you feel different, right? Now we're going to try taking a deep breath. This is the most popular stress management technique. It's very portable, and it's very frequently used. Let's just start by taking a deep breath in, breathing in as deeply as you can, and hold it at the top. And then exhale slowly. Can you feel that relaxation response as you exhale? And just notice how different your body feels now than it did even just like a minute ago looking at those other pictures. Let's do it one more time and really focus on the exhale this time. Breathing in as deeply as you can and hold it at the top. And now let go slowly. Just imagine you're just shaking off everything that you had to do today or think about today. Just let it go. Can you feel that? That is the relaxation response. It's the opposite end of the autonomic nervous system. On the other end is the fight or flight response. So if you've got a fight or flight response, that's like the gas pedal of your autonomic nervous system. That's the part of your nervous system that does stuff without you thinking about it. It makes your pupils dilate. It's responsible for digestion. It moves blood from your internal organs out to the periphery when you need to run. That's the fight or flight response. Cortisol goes up. Stress. If you've got a gas pedal, you got to have the brakes. The brakes to the fight or flight response, which is governed by the sympathetic nervous system, is provided by the parasympathetic nervous system. And it turns out when we exhale, it stimulates the parasympathetic nervous system, gives us a big relaxation response. So just think about that. You've got a brake for the fight or flight or the stress response right built into your body. So I tell all of my patients and clients that this is the best time in history to have a cancer diagnosis. More and more people are surviving, even people who would not be surviving these days, people living with stable disease or no evidence of disease who were diagnosed at stage 4. Right now, they're estimating that 67% of the 19 million people diagnosed with cancer this year will survive beyond 5 years. Might even be a little bit more than that now. And as you all know, cancer survivorship comes with a price. There are changes in physical appearance and functioning. Fatigue can last for years after the end of treatment, as can cognitive difficulties. Fear of recurrence is something that I don't know any cancer survivor who does not have some fear of recurrence, especially when it comes time to go for routine follow-ups and scans. People are often left with pain. Changes in sexual functioning or even changes in relationships. Altered financial status. Financial toxicity is very common among cancer survivors. It's a very expensive disease to treat, and that financial toxicity can lead to increased mortality. And then changes in social relationships. I can't tell you how many people have come up to me and said, you know, the people I thought that would be there for me, some of them didn't show up, and that really surprised me. And then there were other people who I didn't really know that well, and they really stepped forward for me. And I also know a lot of cancer survivors who just say, or like Mark Nepo says, cancer has ruined me for small talk. So cancer survivors know what's important, and they sometimes get impatient with people who think they know what's important, but don't really. So that can make changes in our social relationships. And that's tough even after the pandemic, which has also caused a lot of changes in social relationships. So the emotional cost of a cancer diagnosis and treatment is not insignificant. More than 30% of patients report clinically significant distress. This increases obviously with this stage that you're diagnosed at and the treatment that you get and some of the lasting effects of the treatment. Depression rates are 3 times higher than they are in the general population. So 58% of cancer patients report at least some symptoms of depression. 34% report clinically significant anxiety. This is meeting diagnostic criteria for anxiety. And what we find is that those who have early childhood trauma or multiple concurrent life events are more vulnerable to emotional difficulties. If you get a cancer diagnosis after 2 or 3 other what we call life events, you know, you had a major move or a divorce or a family member died, it's almost like your emotional processing system has too much to handle and it just gets all stuck. And so then when that happens, depression comes in as kind of a lid, and anxiety is the same, all those feelings kind of like bumping the lid a little bit like a pot that's boiling on the stove with a lid on it. So it's really important to get in there and treat and heal those, the emotional distress that is just a natural byproduct of getting a cancer diagnosis and treatment. I like to show this slide because it starts here with the completion of treatment. Most people find that when they're done with their treatment, their oncologist goes, okay, great, my work here is done, you are healed, go and rejoice, live a great life. The family members are all like, cool, let's just get back to normal. And people show up on my office saying, you know what, I have no evidence of disease. It's been 2 years since the end of my treatment. Why don't I feel better? It's because there's emotional healing that needs to happen. And emotional healing can't happen until the physical healing has happened because it takes energy and our body takes precedence. So we've got to heal the body. And then once the body starts to heal and you start feeling a little bit better physically, that's when the emotional sequelae will show up. And so you can see here, we've got fear of recurrence, depressive symptoms, fatigue, cognitive difficulties, pain, cancer-specific sequelae. So this is like neuropathies, things like that, or different pain, depending on what your treatment is, digestive issues. Here's one, finding benefit. This is something that we were the first to show that we could facilitate. This is something I think of as like, it's part of the post-traumatic growth literature, but it's kind of like an emotional weightlifting. If you stay engaged with the process of your cancer diagnosis and treatment, if you work through it emotionally, your stress will go up initially because you're dealing with it. But over time, it will go down, and then you will find that you are less stressed out at smaller things than maybe your friends would be. The best example I have of this is a woman in one of our early groups who had a flat tire on her way to work, and she said, you know what, before I was diagnosed with cancer and had a port put in and lost all my hair, this would have been a really big deal for me. But you know, after having all that and going through all that, this is nothing. So I think of it as we find that we call it benefit finding. So it's a strength through adversity, and then return to work. Did somebody have a question? I think we can. I'd like to save questions till the end, so that we don't have to go back and forth. Is that okay? Okay. And then a lot of times folks return to work, but even returning to work it can be problematic. And a lot of folks, if they can return to work, can't work full time 100% like they used to. I've got 2 clients right now that are really struggling because they're only able to work 50 and 60%, and that's just not who they are, and it's really hard, but that's all the fatigue will let them do. And you can see these symptoms last 2 years after diagnosis in some folks, all the way up to 5 years after diagnosis. So this is this period here is called early survivorship, and this is called long-term survivorship. And I think it's really important to know that we see elevations in a lot of these symptoms well after the end of treatment. So it's okay for you to know that everybody does not get back to normal. They call it a new normal, but I don't even know if I like that word. I know Mark Nepo said the door he walked through to get his cancer diagnosis, he could not walk through that door again. You can't go back to that. And he said the same thing about the pandemic as well. We are not going to be able to go back and be the same world that we were before the pandemic. It's changed us sometimes for the good and sometimes not so good. And the same is true for a cancer diagnosis. It changes you. It can be a good thing, though, in a lot of ways, if you can learn to cope with all of these things and work through them. And we've got things that we can do to help you with that. So psychological distress occurs across the cancer continuum. Even in those who have a high family history of cancer, they can have increased distress because of their family history. Diagnosis and treatment, those are obviously really stressful times. And then there's the immediate post-treatment window when people feel like they kind of get spit off the end of a treadmill into this, what we call the survivorship abyss. And then there's survivorship. And we hope to be able to support our patients at every one of these places. So why do I care about chronic stress? Why was I researching the effects of chronic stress on immune function in cancer patients? Because it's not just immune function. We know that chronic stress is associated with increased vulnerability to the common cold. They actually did a study, I think it was in the 90s, where in England, where they give people nose drops with 1 of 5 cold viruses in it, and they measured their stress before they gave them the nose drops, and then they put them in all little apartments. And then they just looked to see who got colds and how bad their colds were. I mean, they really literally weighed their Kleenexes and had physicians like observing and documenting the severity of their cold. And they found almost a perfect linear relationship between how stressed they were at the time they got those nose drops and how bad their cold was. Jan and John, Ron Kiko Glazer at Ohio State showed in a number of studies that chronic stress is associated with slower wound healing. They looked at elderly caregivers and did like a punch biopsy on their non-dominant arm. They also did dental students because the palate heals faster, and they knew dental students would have great oral hygiene. So they gave them a little punch biopsy on their palate and measured how long it took to heal. And it took almost 3 or 4 days later at the times around their final exams than it did when they just were coming back from summer vacation. So chronic stress, most of you know, is associated with high blood pressure and high cholesterol. They did a study with baboons where they gave them all the exact same high-fat diet, and then they stressed some by putting them in different social groups, which is a big deal for baboons because they have to establish the dominance hierarchy every time. And given the exact same diet, the animals that were stressed had twice the plaque formation compared to those that were not stressed. So then, as you can imagine, chronic stress is associated with heart disease, weight gain, in particular, central fat storage. This is the fat that's like brown fat that's around your internal organs, and that seems to be the fat that is more associated with cancer outcomes. Poor control of blood sugar among diabetics, poor health behaviors. So when we're stressed, we're more likely to eat an unhealthy diet. We're more likely to smoke and not exercise. It's also associated with shortened telomeres and telomerase activities. If my friend Alyssa Eppel showed this, telomeres are those little things that at the end of our DNA. I do this because it's like those things at the end of your shoelace. So when DNA is replicating, every time a cell divides, all the chromosomes have to replicate. And every time all those chromosomes replicate, they've got these little things at the end of them get smaller and smaller. They're the things that keep the genes stable. So as cells age, the telomeres get shorter. And Alyssa showed that chronic stress of being a mother of a kid with a chronic illness was associated also in this almost linear fashion with shortened telomeres and poor telomerase activity. This is important because telomeres are important for maintaining genetic stability, and genetic instability is a hallmark of cancer onset. Chronic stress is associated with increased rates of DNA damage and poor repair. And again, this results in genetic instability. Every time a cell mutates, you're more likely to have it become a cancerous cell. Just like with the COVID vaccine, or the COVID virus, we saw over time the virus mutated because it was replicating more and more. The more time people got sick, the more the cells were replicating, the more there was an opportunity for changes in the genome, which would then lead it to be resistant to our immune systems. Chronic stress is also associated with increased VEGF production and vascularization of tumor cells. VEGF is vascular endothelial growth factor. It's a normal protein our bodies produce to support blood vessel production. And so tumor cells start as one cell, then two, then four, then eight, and then pretty soon it's a clump of cells, and they need to have blood vessels to supply to feed all those cells. My colleague Susan Leckendorf, who's working on the Living Well study with me, showed that if you add VEGF to ovarian cancer cell lines, there's receptors on those cells for epinephrine and norepinephrine, the stress hormones. And when you add epinephrine and norepinephrine to the cell lines, they start creating VEGF. And then her colleague Anil Sood at MD Anderson showed in a mouse model that chronic stress was associated with increased vascularization of tumor cells and also metastases, and that they could block it all by blocking that cellular receptor, this beta-2 adrenergic receptor. It's been shown to be associated with increased rates of tumor cells metastases and resistance to chemotherapy. This is why stress management is important. Sometimes a picture is a little bit better. So this is another way to think about stress. Here's stress before work, and this is what stress looks like after work. So I just showed you that big long laundry list of the effects of chronic stress. These are the ones that are important in the cancer arena, all of these. And so this is why I was really interested in doing psychological intervention where we could manage stress, reduce stress, so that we should therefore be able to see improvements in all of these things that would make a difference for cancer survivors. So that's probably pretty stressful for you with hearing all of that. Let's return to our old friend, deep breath. And right now, I want you to just take a minute and just ask yourself, if I was going to give you a stress thermometer where 0 is no stress at all and 10 is as stressed as you could be, what would that thermometer read? Just note it to yourself. Now, let's try taking a deep breath, breathing in as deeply as you can. Hold it. And exhale. Let it go. Kind of remind yourself where you are. You're in your home, safe, you're well. Take another deep breath, breathing in as deeply as you can. And then let it out. Just shake it off. Good. So the good news is, that was the scary news. Here's the good news. Psychological interventions like our 10-week workshop that I'm going to talk about have been shown in scientific studies to reduce distress, anxiety, and depressed mood, to improve social support. I don't know if you know this, but Vitak Murtagh, our Surgeon General, was the Surgeon General for Obama and then again for Biden, and during his 4 years off, while Trump was the president, he wrote a book about the effects of how important social support is. And they're saying social support is like the new smoking. If we are socially isolated, it has obvious and measurable detriments to our health. So psychological intervention improves social support. When we're stressed, we tend to isolate socially. That's when the pandemic was so hard. Having a cancer diagnosis during the pandemic was especially hard. That's why group interventions, I think, are really important. I talked about how a psychological intervention could enhance emotional growth and benefit finding. We've shown in numerous studies that it can improve immune function, and it may improve survival. I'll show you 2 studies that found that. The 2 studies that I'm talking about, these were done in the late 90s, early 2000s. One was done at Ohio State. called the Stress and Immunity Breast Cancer Project. This was with more advanced breast cancer patients, stage 1 through 3. And you can see it had stress management. They taught the participants stress management and coping techniques, health behavior change, relaxation training, education to increase adherence to therapy. So just teaching them about the effects of the chemotherapy they were on, they found helped people stay on their chemotherapy longer. These folks met weekly for 4 months and then monthly for 8 months. So this was a pretty intensive intervention, and this was with 227 stage 1 to 3 breast cancer patients. At the University of Miami, the cognitive behavioral stress management intervention was the one that I worked on. It was a stress management and coping intervention. We also taught about social support. Each week they got a different relaxation training exercise, from progressive muscle relaxation to autogenics, guided imagery, and in even mindfulness training. Participants met weekly for 10 weeks, and this was 240 stage 0 to 3B. So these were a little bit earlier stage breast cancer patients. We also looked to see, these are all, I know it looks like a Turkish rug, doesn't it? But each one of these little things here is a gene, represents a gene. So you see all these little yellow, these green and red blocks. Each one of those is a gene. Each column here is a participant. So I think there's like 6 participants from the control, 6 from the cognitive behavioral stress management intervention. And you can see here that there's really the control side and the CBSM side look about the same. But you can see here month 6, so this is 6 months after the end of the intervention. You can start to see some changes here. There's a little more green here, a little more red here, a little green here, a little red here. And you can see these effects get even stronger at 12 months after the end of the intervention. So all of these genes are genes that are constitutively turned on or off in response to adversity. The good genes, the genes that get turned on are in red. The genes that get turned off are in green. Most of these are immune function genes, but not all of them. You can see here's examples of some of the genes for people that are interested in that kind of stuff. But you can see here that in the stress management group, the good genes were upregulated. They were more likely to be turned on. The unhelpful genes in the control group, the unhelpful genes were turned off. So in the cognitive behavioral stress management group, good genes upregulated and turned on, unhelpful genes turned off. So these cells aren't as effective. These cells in the control condition, the good genes were turned off and the unhelpful genes were turned on. So they had just the opposite thing happening. So what this slide is telling you, you now know how to read a heat map of transcription slides. What this is telling you is that our talk therapy, what we were doing, talking with these women in groups, actually worked its way all the way down to the level of the cell. And inside that cell was helping determine which genes are turned up and which genes are turned down. It's pretty powerful, don't you think? We showed in those 2 studies, this is the Barbara Anderson study at Ohio State, that there was a 56% reduction in death. At the Miami the cognitive behavioral stress management, there was a 79% reduced risk of death. These look different because we had different numbers. This was an earlier stage, so we didn't have as many deaths, but still there's a 79% reduction in risk of death. If these were chemotherapies, they would be on the market right now making money. But guess what? They're sitting on the shelf, or they were. I left Fred Hutch and started the Orion Center for Integrative Medicine so that I could get empirically supported interventions like this out into the community. And now Harmony Hill is helping me do that work because they've got the machinery to do it, and they're amazing partners. Also, when you look at in this study here, those changes that I showed you in gene transcription, those changes in part mediated the effect of the intervention on survival. So they had an impact on, the impact was important. So does anyone want to learn a few stress management and coping techniques right now? I'm guessing yes. So how stressed are you right now? Again, 0 is no stress at all. 10 is as stressed as you can be. Let's do it again. Let's take a deep breath. And I want you guys to report afterwards, like what your stress levels were before and after. So again, let's try it. Just take a deep breath. I told you this is the most frequently used stress management technique. We'll get to others, I promise you, but I'm really dialing in on this one because we've always got it with us. Just taking a mindful pause and breath can make all the difference in the world. So let's just do that. And let's do another one. Breathing in as deeply as you can and hold it at the top. And then let it out slowly. Letting go, letting go. And let's do even one more, just for the heck of it. Breathing in as deeply as you can. Letting it out slowly. Just imagine you're sliding down a slide into a state of deeper relaxation. And how stressed are you right now? Did that move the needle at all for you? Was there a change in your number before to now? Even just asking yourself, what's my stress thermometer saying right now, is a stress management technique. Because if it gets above 5 or 6, even naming it is helpful. And then just stopping and doing what we just did, see if you can bring it down 1 or 2 is great. If it's really high, maybe you need to do something a little more intensive, which we'll talk about now. So what is stress? It's the physical, mental, or emotional tension that we experience in reaction to an event. It's not the event itself, it's our reaction to the event. The example I always use is shopping at this really fancy mall in Bellevue. Bellevue is a very fancy part of town in the Seattle area. It's called Bellevue Square. And I'm tall. Most people, when they see me after they meet me on Zoom, they're like, wow, you look much taller in person than you do on Zoom because I'm 6 feet tall. So it's been really hard for me to shop. I can't just go into most stores and try something on. So I hate shopping. If I have to go shopping, I have a friend who loves shopping that I take with me, my friend Lisa. So when I think Bellevue Square, I'm stressed. When she thinks Bellevue Square, she's like, cool. So it's not Bellevue Square that's stressful. It's our response to Bellevue Square. And that could be anything. But the important thing to remember about this is it's not what's happening out there, it's what's happening in here. And that's good news because we have control over that. So we typically experience stress when we perceive that the demands of a situation are exceeding our resources. So our resources are time, money, knowledge, help getting things done. This is what stress looks like. The important word in this thing is when we perceive that the demands are exceeding our resources. So if I've got just a little bit of time left, got an hour left, and then I think about everything that I need to do, not just tonight, but tomorrow or the rest of the month. If I put that whole bunch of stuff into my demands bucket, and all I've got is this little bit of time right now, I'm going to be stressed. So it's really important to be aware of perception. What are your perceived demands? What are your perceived resources? Are you thinking of all the resources that you have? Do I have somebody coming in to help me the next day? Could I bring somebody in to help me? Here's another way. I think pictures can be really helpful. So you can see that her demands, this is not my desk, her demands are greatly exceeding the desk space, which is her resources. Another question that I get asked a lot is all stress bad? Some people say, I love stress. I work so well under stress. And the answer is, all stress is not bad. You can see here on this axis, we've got increasing stress. And on this axis, we have performance, could be immune function, or any of those other things that I showed you were associated with stress, because that's associated with chronic stress. And you can see there that with increasing stress, we actually see improvements in performance and also immune function. And then we get into this zone here where people get into this sort of groove. It's like, yeah, I love this sort of stress. I work really well at that. But then if you go up too high, or it becomes really chronic, you can start to see that performance and immune function starts to deteriorate. And eventually, it can lead to breakdown. However, if you use stress management techniques, you can continue to see improvements and at higher levels of stress, and also not see that the effects of chronic stress at this far end of the curve. So it's important to know that not all stress is bad. We just have to keep it in this healthy zone here. So how do we manage stress? We do it by decreasing our perceived demands and increasing our perceived resources. So decreasing perceived demands, do you have to get presents for everybody? Do you have to go shopping for everybody? Do you have to, do you really have to do everything that you have to do? Do you have to do it today? Is there anybody, and then that's thinking about resources. Is there anybody that can help me with this? Can I get myself more time? We manage that by changing our perceived demands and our perceived resources. I remember one time I needed to cut a bunch of turf out of my backyard because I was putting in a play structure and I had to put down chips. And I was just cutting it out by hand. I remember thinking, I need some support here. I need some practical and tangible social support. Who can help me with this? And I couldn't think of anybody because my friends were all getting kind of old. And then I played basketball the next week and I had all these young kids on the basketball team. And they're like, oh man, we would have totally come and helped you. But the demands were I had to cut all this turf. My resources, my energy and my body weren't quite enough for it. And I didn't think about these other resources that were available. Here's another way to manage stress. I think cartoons can be helpful. This says, try these relaxation methods. If they don't work, I'll prescribe a tranquilizer dart. This is my dream, what the doctor says to the patient here. Try some relaxation methods. I actually have a friend who's a physician at Fred Hutch, and their family was going through a big stress thinking about a move across country. And she started to notice some problems with her stomach. So she went to her doctor and said, hey, doc, my stomach's kind of bugging me. I think it might be stress. And her doctor was so bummed that she couldn't help her with that. She gave her a prescription for Prilosec, and she said, well, you'll have to keep taking this for a long time. And my friend said, really? That's the best you can do? And so her doctor the next day texted her or called her and gave her a name of a hypnotherapist. The hypnotherapist gave her a 10-minute guided relaxation. And that's what she practiced, and her stomach was fine. She didn't have to take the Prilosec. So this is my dream. Here, try these relaxation methods. If they don't work, then we'll prescribe something. We're not quite there yet. So step one in stress management is increased awareness. You can't do any stress management unless you know you're stressed. That's why it's important to be asking yourself, take pause moment periodically throughout the day. What's my stress thermometer saying? Do I need to take a deep breath? Do I need to do something else to lower it? So how do you know when you're stressed? We can tell she is stressed. Why? Because her hair looks like this. No. She's got, you can see it's after 5 o'clock, so her time resources are shot. She's in negative territory, and it looks like her work demands are great because her eyes are like this. And this is one of the slides that Stephanie's going to help me with. So then how do you know you're stressed? Turns out there's a lot of different symptoms of stress, and we teach this awareness because this is going to be your check engine light. You know you're stressed when you get resentful, or you start to get headaches, or maybe you have poor concentration. So hostility, resentment, headaches, backaches, ulcers, muscle spasms, sleep difficulties, depression, drinking or drug use, irritability, fears, neck aches, withdrawal, physical weakness, insomnia, chronic diarrhea, low self-esteem, obesity, poor concentration, constipation, indigestion. Our gut is really highly innervated by the sympathetic and parasympathetic nervous system. Muscle tension, like in your neck, shoulders, irritable bowel symptoms, anger. So if you find you're more irritable or angry, then you need to just ask yourself, am I stressed right now? Do I need to do something to manage that? Maybe it's something a little more subtle, like you just start to feel this tension in your neck. We have folks in our workshops circle 3 of these, the 3 that are the most problematic or the most obvious when you get stressed. And then you start watching for those. If you start to notice that you're irritable, you need to say, wow, maybe I need to do some stress management. My little check engine light has come on. Or you feel your shoulders are up like this and your neck muscles are really tense. Oh, I might need to do some stress management because my little stress check engine light came on. So when you think about the symptoms of stress, they are cognitive, emotional, behavioral, physical, and social. It affects us in all these different ways. Social isolation, poor concentration, irritability or anger, poor sleep, or eating changes, like stress eating, physical, like the digestion problems. And like I was saying before, the good news is that it's thoughts that determine feelings. So here's the situation. This is Bellevue Square. This is anything that's happening in the world. The good news is that we perceive these things, that scale about demands and resources. We're perceiving it, and then we think about it. There's all these things in our brain. What's our history like? What resources do we have with respect to knowledge? Who are our friends that we can call in? So all of those things, all of this situation gets processed in your brain. What's my shopping experience been like? Lousy. Okay, so if I'm at Bellevue Square, if this is the world, I'm going to feel like this. My friend Lisa is going to feel like this. But this is the good news, is because we can do something in here. We can change the way we think about a situation, and that will change the way we feel about it. So just to demonstrate the incredible power of our minds, I want you to just humor me and try this little experiment. So go ahead and close your eyes and just imagine a lemon. It's a beautiful yellow lemon, very ripe. You can probably smell it a little bit. It's on a white cutting board. Beside the lemon on the cutting board is a nice sharp knife. I want you to pick the knife up carefully and cut the lemon in half. And as you do, all these juices kind of run out. You can smell that little bit of lemon essence that comes from the skin as you do it. Now I want you to pick up half the lemon, and I want you to take a bite of it and just notice. Do you salivate? Do you get chills down your back? Do you pucker up? When I do this in person, about half the audience puckers up, and almost everybody at least salivates a little bit. I actually had a patient who had head and neck cancer and had lost some saliva gland function use this to enhance her saliva production. She would always have to have some water with her to keep her mouth wet, and she was able to use this so she didn't have to use the water as much. So we've got the stressful situation, how it affects us all, but here's the good news. There are thoughts that happen in between the situation and all the symptoms of stress. Most of the time, these thoughts are automatic, and a lot of the time, they're not helpful. So in our workshops, we talk about how you can slow the process down. What is it that what is the thought that I'm having right now? Is this thought accurate? Or is it not accurate? And if it's not accurate, what's a more helpful thought? So I could think, okay, we're going to Bellevue Square. I'm sorry to keep using this, but I think it's helpful to use the same example. And I could think, I never have anything that will fit me, and that really sucks. Why would I want to go to Bellevue Square? And then I remember, well, you know what? Sometimes some of the stores now, especially some at like Eddie Bauer, they're starting to carry tall clothes. So maybe I will be able to find something. So I just check with that, and maybe I can adjust it just a little bit. Sometimes our automatic thoughts are helpful. Sometimes they're not helpful. If they're not helpful, then we can change them to more helpful ones. Even just having the thought, I might not be thinking about this situation accurately, is helpful. What do we do if we have the automatic thought before a follow-up screening exam, or you feel a pain in your back? You have the thought, oh, I wonder if my cancer's come back. What do you do with that automatic thought? That's pretty scary, and it makes sense. If you're a cancer survivor, that's what people think when they start to feel aches or pains here and there. So the automatic thought would be, oh no, my cancer's come back, and you could catastrophize after that. It's not going to be treatable, etc. Or you could think, you know what? I don't know. I don't know if it's come back or not. I'm going to pay attention to this pain in my back. I'm going to talk to my doctor if it's still there in a couple of weeks. It could be a muscle ache because I did some gardening yesterday, or I slept funny. It could be something else. The last scan I had was perfectly fine. I always tell folks you're only as good as your last scan. If your last scan was great, you're in good shape. If not, you've got some work to do, and you'll cope with that if and when you need to. But you can see the power of thoughts. Even just saying, I don't know what it is. It might be this, but there's a very good chance that it's not that. Most of my clients come back when they have this fear and they get the scan. It's like, oh, it was just this. It was nothing. It was not cancer. It was a a pinched nerve in my back. It's important to remember that. Normal health issues can come up for cancer survivors as well, quote unquote, normal, non-cancer things. So we challenge our automatic thoughts if they're not helpful, and then look to see if that helps you feel better. Sometimes we feel stress unnecessarily because we're having these thoughts that are not really helpful or accurate. You need to challenge them, and if they're not helpful or accurate, you can change them to more helpful ones. If your thoughts are accurate, though, then we move into what we call coping. And I think all situations have controllable and uncontrollable aspects, and so we cope with them differently. We use problem-focused coping for aspects of the situation that we have control over. So even with the example of, will my cancer come back or not? That might seem like, wow, I don't have any control over that, right? But you do. You have control over managing your stress, your diet, exercising. All of those things can be really helpful. You can ask for help from your doctor. What can I do to keep my health better? Get more information. Is there another treatment that I need? Emotion-focused coping is with the part of the situation that we don't have any control over. So you can do all those things and your cancer still could come back. So talking to a friend if you feel your stress coming up about that, especially before a scan, and then doing relaxation practices just to bring your stress level down. When we're stressed, we're more likely to perceive our environment as stressful. So the more you can keep bringing it down, the better off you are. Also, when stress is high and chronic, if it stays high for a long time, then you see the effects of chronic stress. But if it's high and you can bring it down periodically with relaxation techniques, even if it goes back up again, it looks more like an acute stressor, like that healthy part of the curve. So regular relaxation practice is really helpful. I had to throw this in because it's the holidays. Dark chocolate helps ease emotional stress. You heard it here first. It's in the Journal of Proteome Research, so you know it's got to be good. Anyhow, everything in moderation, I say. Exercise is a great way to cope with stress. When you think about the fight or flight response, it's our bodies want to move when we're stressed. You know, sometimes we can if we're stuck in traffic, but exercise is great. Yoga is nice because it's kind of a meditation and it's exercise, or movement at least. Social support is a really potent buffer of the effects of stress. And meditation, like mindfulness meditation. Here's another one. This says your stress level is high. Follow me to the lab. And here's the lab. Isn't that cute? So pets are great sources of social support. There was one study at a conference I went to where they had recently bereaved widows and widowers, and all they did was they went to a shelter and they got them a dog or a cat, and they saw great improvements in their immune function and health overall compared to the people that didn't want to get a dog or a cat. So pets really can make a difference. If you pet them, your blood pressure goes down for them and for you. I mean, yes, they can be stressful, but dogs need walking. So there's also a lot of truth in this one. Another thing that has been recently found to be helpful with coping with stress is gratitude. We're wired, our brains are wired to find threatening things in the environment interesting. That's why the news is filled with, like, if it bleeds, it leads. We're wired for that. And you can imagine how that would be adaptive. Our caveman ancestors, the one that was like, ooh, saber-toothed tiger, I don't know about that. I'm going to just step back. When this kind of threat sees it as a threat, is going to survive. But the guy was like, hey, cool, isn't that cute? I love that coat, and goes towards it. He didn't live. So you can see how finding threatening stimuli scary is going to be adaptive. Unfortunately, we don't see the good things. The good things that are happening in our life don't stick as well. So I think if it's threatening, it's like Velcro, it sticks. If it's not, if it's good, it's like Teflon. We've got to do something to help make it stick. And writing down the things you're grateful for is really helpful. And what that does is it's not the opposite of stress, but it builds this, it's called broaden and build, and it builds a more grateful approach to life. When you start writing these things down, you start looking for the good. So we talked about, like, looking at your world, and you can choose, like, you can think of the snow as this awful thing, or you can think of it as this really beautiful thing. Depends on how you look at the world. And gratitude is a really great way to do that. Also, writing down what gives your life meaning. It's really important to think about what's important to you, what gives your life meaning, and what do you value? And your behaviors and actions should be aligned with that. So I think it's really important to just write down regularly, every day if you can, what gives my life meaning? What am I grateful for? And then I also like to write wins. What did I accomplish? Sometimes I feel like, oh, I didn't get anything done today, but even just getting up and getting dressed sometimes can be a win or an accomplishment. And the more we write these things, turns out this is really very powerful motivation to want to go out and do more. And over time, you just start feeling better. It helps with depression and anxiety as well. So mindfulness, I'm sure a lot of you have heard about mindfulness. How does that work? Staying present in the moment reduces stress because it just gives, all you have is this moment. So you don't have to think about all the things you're going to do before or after. You just have this present moment. Living in the past or future brings the past and future demands into the present. So if you're worried about what happened yesterday, think about that demands bucket on our teeter-totter. If you're thinking about what didn't go well yesterday or what you've got to do next week, that's putting all that stuff into your demands bucket, which is really always fluctuating. It's in the present moment, and it adds to your perception of stress. So if you just think, what do I have to do in the present moment? Right now, all I have to do is be talking with you. I don't have to think about everything else. And so I'm not stressed. I enjoy talking to folks. Planning is good, but when you plan, just plan and then execute that plan moment by moment. I know when I meditate, I always tell you, what are the thoughts that come in? It feels like I'm planning all the time. Then I say planning, and I return my attention to the breath. Multitasking, which is actually not possible, it's sequential tasking. It's less efficient than doing one thing at a time. So if you've got good focused attention, just do one thing and then move to the next thing. Trying to do two things at the same time will slow you down and be more stressful. And if you can be mindful while you're doing those things, like washing the dishes, just really be focused on washing the dishes. Feel the soapy water in your hands. Just notice how your hands are moving and cleaning and how you're making progress cleaning the dishes. But if you're washing your hands and thinking, okay, then I got to do the laundry and I got to get the kids to bed, you're bringing all those stressors into this moment. But you could take even washing the dishes and make it into a little mindfulness time for yourself. Guided imagery can be really helpful. Health Journeys has a lot of really good ones. There's a ton of things out there. The Insight Meditation app is a good one. I'm blanking on the other. The Calm app is good. We have 10 different guided imagery and relaxation exercises that we use as part of our workshop, and those will eventually be able to be available for folks who are signed up with Harmony Hill. But Health Journeys has got some great ones. This woman named Bella Ruth Naparstek has been doing this for years. Successful surgery, if you have surgery planned, this is a great one. She has words and music, and the words just evoke really relaxing images, like everything's going well. There's all these people that care about you that are looking down on you. And if you listen to that for a week, the words and the music before your surgery, and then listen to the music alone on the day of your surgery, this particular guided imagery has been shown to reduce length of stay in the hospital, pain medication usage, blood loss. I mean, she's done a lot of research with her products, and so that's why I like to use them. It's really helpful. I even use this one when I've had to have surgery. There's even ones specifically for chemotherapy and fatigue, relaxation and wellness, and helpful sleep. This one has been shown to improve not just the quantity of sleep, how long you sleep, but how well you sleep. So I think you can get these on Audible too, but this is a great way. When we're thinking about emotion-focused coping, we talked about relaxation exercises. You've done all the problem-focused coping you can do. This is great. Most of our workshop participants try to do a half an hour of relaxation 5 days a week if they can. It's just a nice thing to do. I had one woman tell me that she thought it was better than chocolate when she had gotten practicing with it. And here's the other thing I'm really excited to talk about. This is coming in 2024 to Harmony Hill. This is the next gen version of the study that I told you about from the cognitive behavioral stress management intervention from the University of Miami. We took that, we added it, made it more intentionally mindfulness based. We added a whole chapter, this one here called ACT, or Acceptance and Commitment Therapy. This is solely for working with fear of recurrence. We have a chapter on spirituality and mortality and your life goals, what's important to you, what gives your life meaning. social support, communication skills to support our social support networks, because social support can be stressful sometimes too, right? Coping, we go into more detail about the coping strategies I talked about, and then also like your awareness of stress and how to work with automatic thoughts, only in a lot more detail. We're calling it Living Well, Web Enhanced Lessons for for Cancer Survivors. We are delivering this now in a big study funded by the National Institutes of Health on Zoom video conferencing. We wrote this grant before Zoom was popular. I used to have a little slide that said, here's what it looks like to be on a Zoom call, which is kind of funny now, but we did not miss a beat. Most research studies like ours really took a hit when the pandemic happened, but ours, we did great. And we're just about done. We've got one more year of the study. So once that's done, it is going to be disseminated through Harmony Hill. And you'll be able to sign up for it probably in a few months. I've got to give them the dates that we're going to do it, but you'll be able to sign up for it in a few months, I'm guessing. So what is Living Well? It's 11 two-hour sessions. The first session, we call it week 0. It's just, can everybody get logged in okay? We do all the housekeeping things. We do our introductions there, so we have more time for people to share their introductions. And then there's 10 weeks of really solid stress management and coping skills, and great 10 different relaxation exercises, including progressive muscle relaxation, guided imagery, autogenics, 3 different kinds of mindfulness meditation, including metta, which is loving kindness meditation. You'll get a workbook with all the material in it, all these relaxation recordings, which you will be able to download or have access to, and video access to the group. So we can deliver it to anybody who has internet access, which is pretty cool. What participants have said. I didn't know I needed this workshop, but I did. Living Well has been a game changer for me. I don't feel alone anymore. I think every cancer patient should go through this course. So that's it. Any questions, or would you guys like to do a little more guided relaxation? I've got like a 5-minute guided relaxation I can do. Can you unmute them and see what our requests are?
Another meditation would be great.
Yeah.
Okay. Does anybody have any questions, first of all?
I don't have any questions, Bonnie, but I just wanted to say that it's so exciting to me to see all this stuff coming to Harmony Hill. I live really close to there, and it's a place that's near and dear to my heart. Also, a couple of things that stood out to me with your discussion today was about the automatic thoughts, and that we actually do have the capability of recognizing that. We have to learn how to recognize that, right. And then we can decide, okay, is this helpful? Is it not? It's taking me a while to do that, but I really like that part of the practice. One other thing is that when I was struck by your comment about planning, and just said, planning is good, but just plan. And what I find myself doing when I plan is that I get attachment to the plan. And then it causes me stress because it's not working out the way that I planned or whatever, because there's always variables in life. Right. So those 2 things really hit home, and I appreciate you bringing those up
sure.
in the discussion tonight.
So when you're planning, you might be thinking like, am I giving myself enough space in my day? Sometimes we try to stuff too much into a day, and then if anything goes amiss, then it is stressful and you can't get everything done. So it's important to look at your automatic thoughts around your plan, even when you're setting up your plan. Am I being realistic with myself? Am I giving myself a little bit of grace around this? I think the more spaciousness that you can give yourself. I also have things that I have to do, and then I've got some of the things that I'd like to do. And so there's even ways you can work with that planning. But I think if you execute your plan, if you're in a mindful fashion, moment by moment, staying really present, that you will be more efficient. I know on the days when I was working at the Hutch, if I sat and meditated for 10 or 20 minutes before I started my day, I always got everything done on my to-do list. But if I didn't do that, I felt like I was just spinning around in my chair all day doing this and that, and I got a fraction of the stuff done. It wasn't just about being too busy. So it's worth a try. And I think just it's a good reason for thinking about having a regular meditation or even just a guided relaxation practice. Meditation isn't for everybody, but guided relaxation can be really helpful too.
Mhm. Yeah.
Thank you for your comments. That was really nice. Any other questions or comments? Okay, let's just do a little, I'll just leave you with a nice little 5-minute guided relaxation. This is my light imagery one. Some of you might be familiar with it. So go ahead, get yourself comfortable, get yourself kind of sitting squarely in a balanced way on whatever you're sitting on. Whenever you're ready, close your eyes. And just start by taking a deep breath and kind of pat yourself on the back for giving yourself this time to learn something new, how to help your body. And then take another deep breath, breathing in as deeply as you can and hold it, and then let it go. Good. Just bring your awareness to physical sensations in your body. Notice where your body's coming in contact with the chair that you're sitting on, and just let it hold you, kind of sink into that support. And then scan your body from the top of your head to the tips of your toes. And just look for any places where you're holding tightness or tension, like in your neck and shoulders, maybe your calves, your legs. And if you find a spot like that, just kind of imagine breathing into that area and let the tension go with the out breath. Good. Now see, feel, or imagine a ball of light above your head. This light is healing, relaxing energy. Make it whatever color it needs to be. Now just let that ball of light sink in through the crown of your head and just see it work its way into that beautiful, busy brain of yours. And as it enters your brain and starts expanding, it's just see it surrounding every single neuron in your brain with this healing, relaxing light. You notice that as your brain gets filled with this beautiful light, your thoughts start to slow down and become more clear, just like a lake on a calm day where you can see all the way to the bottom. That's how calm and clear your thought will be. Now let the light continue to expand to your forehead. Let it relax your eyebrows. See it move into the muscles around your eyes, filling those areas, and your eyes soften and relax. Good. Now let it work its way into your cheeks and your jaw. We hold a lot of tension in our face. Just let the light fill those areas. And as the light fills those areas, feel those muscles just relax. Your teeth part a little bit. Good. Now your entire head is filled with this beautiful, healing, relaxing light. Now the light melts down your neck and into your shoulders, completely filling those areas. And as the light surrounds every cell in your neck and shoulders, notice how your neck and shoulders relax. And just let them relax, even just a little bit more. It's as if a great weight has been lifted from your shoulders. Good. Now let the light move into your arms, forearms, and hands, all the way to the tips of your fingers. So that now both your arms are completely filled with this beautiful, healing, relaxing light. And your arms relax. And just let them relax, even just a little bit more. Just let them get really heavy. Good. Now let the light work its way into your chest and upper back. Take a beautiful breath in and let the light come into your lungs. See the light filling your lungs. And with the next breath in, see that light in your lungs move to your heart. There's a big vessel connecting the two. Now your heart is filled with this beautiful light energy. Healing, relaxing light, filling your heart. Just feel your heart softening and warming with it in there. And then now just see how your heart is pumping that light throughout your body. And know that for the rest of this day and into the evening and even tomorrow too, that every beautiful breath you breathe in, you're breathing in this beautiful, healing, relaxing light. It's moving from your lungs to your heart, from your heart to the rest of your body. Good. Now let the light work its way down into your abdomen and lower back. So now your entire torso is filled with this beautiful, healing, relaxing light. Just pay attention to how the light feels in different parts of your body, especially your torso. Do you need a different colored light in some areas than others? You can change the light to make it just right for that, whatever area that is. And then as your torso fills with this light, notice how your abdomen and lower back relax. Just let them relax even more. Good. Now let the light move into your legs, calves, and feet, all the way to the tips of your toes. So that now both your legs are completely filled with this beautiful, healing, relaxing light. Every cell is surrounded and bathed in this beautiful light. And your legs and your feet relax. And just let them relax, even just a little bit more. Just let them get really heavy. Good. Now take another beautiful breath in, and as you do, you'll see that the light that completely fills your body now gets a little bit brighter. It's so bright that it's glowing on the surface of your skin. Now just imagine that you step outside your body and look to see, are there any areas that need a little more light? And isn't it interesting that you can step out of your body and look at it to see where it needs some more light? And if you find an area that needs some more light, or maybe a different color light, just use your breath to bring light into that area. Good. Now take another beautiful breath in, and as you do, that light expands, and it makes a beautiful cocoon all around you. All around you. And now just notice what it feels like to be in this beautiful cocoon of light, feeling very safe, very deeply relaxed. And then one last time, give yourself that little stress thermometer. What's it reading? And if you want, just for fun, you can imagine that thermometer right in front of you, see the red stuff that's in it, reading whatever your stress number is. Put your finger on it and take a deep breath in. And as you exhale, see if you can pull your finger down and move that stress number down a half a point or even 1 point. And see if your body will follow suit. Good. Just notice what it feels like to be in this place, feeling relaxed. And is this something that you're willing to give yourself? This took us maybe 5 minutes to get here. Well done. Now I'm going to count from 3 to 1. And as we do, you can gradually bring your awareness back to the room, coming back feeling refreshed and alert and ready to do whatever else you need to do this evening. 3, becoming more aware of your legs and feet. Maybe wiggling your toes a little bit. 2, becoming more aware of your hands and arms. Maybe wiggling your fingers a little bit. 1, becoming more aware of your head and neck. Moving your head, that's it. And then whenever you're ready, open your eyes and bring your awareness back to the room. Well done. What were your stress numbers throughout this, if anybody has them? I'm just curious. Does anybody want to share?
My stress was 2,
Hmm.
and I definitely got it down to 0, especially during that meditation.
Nice. Thank you, Kathy. Thank you.
From 5 to 0.
Wow. Good. Nice, Stephanie. You're a rock star. Anybody else want? Kelly, you want to share what yours were?
I was 5 to 0 as well. Yeah, I'm very
Nice.
zen right now. That was wonderful. Thank you.
Yeah.
That's awesome. How about you, Kathy?
I was about a 4, and I would say I'm about a 1.
Great. Well done. Did anybody try putting their finger on the thing and pulling it down? That actually works sometimes. You can actually just like pull your stress level down. That's cool. Does anybody else want to share? I see Jen and Sherry. I don't know who else is on here, but you don't have to. Thanks for sharing your screen, guys. It's always nice to know who's out there.
Yeah.
Thank you for showing up too. This was our first one. Yay!
Yay.
You guys made history today. And this recording will be available, right, for people who registered. So if you want to go back and listen to it again, and I can even send you a 10-minute version of that relaxation that we just did, so that Trina can send that out to you guys if you want it. Would you like that?
Yes, I would like that.
Okay.
Thank you.
You're welcome. All right. Any other questions? All right. Well, thanks so much for showing up, you guys. I really appreciate it. Yay. This is our first one.
Yeah.
Thank you.
There's going to be
Thank you,
more.
Bonnie.
Orion providers are going to be talking about different health topics. This is kind of like a new series that we're starting. So watch this space
Okay.
and watch and come back and look for when we start the groups again. It should be cool. I'm excited about that.
Good. Thank
Right.
you.
Thank you for joining us, Bonnie. We really appreciate
You bet.
your time and your expertise.
Very welcome. Always a pleasure.
gonna-
Bye, guys. Have a good night.
Night, you too. Bye.